So this is interesting. There may be some hope with dealing with that annoying COVID. We know COVID is not going anywhere. It's coming season after season. We're seeing it all among the schools now because all the kids are back in schools and they're all getting sick. And yes, COVID's still going around. And it's really annoying because we already had to deal with colds and flus, and now we have to deal with COVID. But a study came out that showed that this common allergy spray available over the counter can reduce the incidence of COVID by up to 67%. Oh, yeah. And so it's called Astepro. And the study said that they think the reason why this allergy medicine is working is because it can link to the ACE2 receptors in our body, which means the COVID virus can't link to that receptor, get in and affect the cell, and then you get sick and the whole thing. So that's one reason, but there's also a preservative in it, benzalkonium chloride, I believe it's called. And so they think maybe that was part of why it was disrupting the chance of getting sick from the virus. But apparently that preservative is in other nasal sprays too, where they didn't see the same effect. And it's kind of a coincidence because a while ago out of Florida, there was a study with Benadryl and lactoferrin. Using that together also decreased the viral load, the chance of getting COVID. But the thing with Benadryl, and I've talked about this on the channel before, is it is an anticholinergic antihistamine, which means it does affect the brain. It's been implicated. Can this lead to dementia when used often? So that's the concern with medications that have an anticholinergic effect. So it does get into the brain. Well, apparently Astepro, this allergy nasal spray, does not cross the blood-brain barrier, and it doesn't have anticholinergic properties. So we don't worry about the side effects of dementia like we worry about with some allergy medicines. And so, what else? What we know is you would not want to use it every day because in the study, like they had the placebo group of patients with COVID that were not given this over-the-counter medication. But it also comes in prescription, by the way, and it's interesting because the prescription is actually a lower strength. The over-the-counter is a higher strength. A couple of reasons for that. The higher strength means you only have to do it, or one would only have to do it once per day, and it doesn't give you the metallic taste like the prescription type does, which is a lower strength, and you have to do that one twice a day. And it leaves you with a metallic taste in your mouth, even though it is a nasal spray. Well, anyway, in the study, the patients that did not receive the medication had more adverse outcomes, like more bad outcomes, than the group that was receiving the nasal spray. And what they also found was the Astepro nasal spray actually decreases the viral load, which means basically like how severe is the COVID, right? Because if there's less COVID virus, you're going to be less sick in so many words. So that was really good news about that too. Astepro has been available for quite a while. There's been allergy users that have been on it quite frequently. And coincidentally, some of those users say they never got COVID or their COVID was very mild. Remember, doesn't that sound familiar? Remember the thing about some cigarette smokers that were saying they weren't getting COVID or it wasn't bad. And we were just baffled, like, how can that be? You would have worse lung health if you're a cigarette smoker. Well, it turns out the nicotinic receptors, right, with nicotine, if they were latching with those receptors, then the COVID virus could not latch onto those in so many simple words. There's more to it than that. But so same principle. Now, I would recommend you talk to your doctor. Don't just go out and take it. I would never recommend to my patients anyway that they just be on this every day. However, I've talked to one of my patients who was getting ready to take a trip out of the country. They're going to be on the plane a long time. And so we had a long talk about the Astepro nasal spray. There are side effects with it, like dry nasal passages, nosebleeds, things like that. Like anytime you're using a nasal spray that's a medication, there can be side effects. It's not a steroid, though, so we're not worried about those kind of side effects. So there is very promising, effects with this simple, affordable over-the-counter medicine. I think over-the-counter it's about $30. I think if someone opts for the prescription, it can bring it down to anywhere to $10 to $20, but then you have to have your doctor willing to prescribe it to you. And how I'm going to use it with my patients, if they have COVID, it's a great adjunct to decrease their viral load and improve outcomes. Or if I know they're going to be in a crowded area, like they're taking a trip, they're going to be at a convention, or they're in crowds, or they're going in, or they work in the hospital, like around very sick people, I can think of that too. And plus, like the allergy sufferers that I know, a lot of them have asthma too, and I'm very concerned about them getting COVID, even though a lot of the COVID now is more mild. So this is a very fascinating study that came out. The Astropro nasal spray can reduce incidences of COVID by up to 67%. Now, there's more to it than that. I'll try to link the study here. I'll pop up the picture if I can find it for you, but very fascinating. Thanks for being here at Vitalize Health Partners. Go ahead and give a like to the video if you did not know this, and if this is helpful to you, leave a comment below if you knew about this. And, because there's other safe over-the-counter and natural remedies that bring down viral load and help. But, when they were rolling out the COVID injection, they wanted everyone to focus on that. They didn't want to spend time on all these other things that help. But now the information's coming out. So I hope that's helpful. Remember, this is just for education and entertainment. Anything that you decide to do, please talk to your doctor, because even though I am a doctor, I'm not your doctor. So make sure you do that. Okay, thanks for being here, and I'll see you on the next one.